Welcome to the SBIRT training for nurse practitioners across the lifespan case scenario series. This project was supported in part by funds from the Center for Substance Abuse Treatment, Substance Abuse and Mental Health Services Administration, the Department of Health and Human Services, under the grant SBIRT Training for Nurse Practitioners Across the Lifespan. The information or content and conclusions are those of the authors and should not be construed as the official position or policy of, nor should any endorsements be inferred by the Center for Substance Abuse Treatment, SAMHSA, the DHHS, or the U.S. government. The authors have no conflicts of interest, and we hope you find this series of case scenarios educational and useful in your practice. Kevin DeAngelo is an 18-year-old male. Kevin's baseball coach sent him to the clinic due to breathing issues during his practices. He smokes in order to calm down while studying and does not see it as an issue. At the same time, he is very concerned that he will be kicked off the team if his coach discovers he is using tobacco. The objective of this case vignette is to compare and contrast two approaches to screening and intervening with a patient who uses tobacco. While watching this first scene, please note areas for improvement.
Deep breath in. Oh. Yeah, you're having some congestion for sure, Mr. DeAngelo. It says here on this screen that you took before you came in that you are a smoker?
Yeah.
Yeah. So your cough's most likely related to smoking. Have you stopped smoking or in the past or tried to stop smoking?
No.
Because it's really not good for your health. If you look at some of these statistics, you're at real risk for cancer and making your cough worse, COPD. So yeah, I'm definitely gonna ask you to stop smoking. Okay. You're a young guy. It should be easy for you, and there's a lot of health benefits in stopping smoking. And I can prescribe things for you like lozenges, and in fact, before you leave, stop, you'll get some gum, some lozenges, there's inhalers, whatever you want, and, we'll help you out with the smoking, and that should help, with the coughing and make your coach a little bit happier.
Okay.
Yeah. So, does your coach know that you're smoking?
No.
Okay.
No.
So, definitely be a little bit on the down low with the smoking, because you don't know what people talking about, and if you came in for smoking, we don't know what's gonna, people talk. It's a small campus.
Okay, but my coach isn't gonna find out, is he?
I'm not gonna tell your coach.
Okay, because he can't find out just because he'll kick me off of the team. And
yeah, well, yeah, and I'd be concerned, for being caught, but I'm not gonna tell. But this is a small campus, and I want you to make sure that you really try hard, and I know you can stop smoking, and you're going to alleviate a lot of these risks if you do. Okay?
Okay.
So, pick up your smoking tools on the way out. I'll prescribe that for you, and then we'll follow up in 2 weeks.
Okay.
Excellent. Thanks.
Hi, Mr. DeAngelo. I'm Holly, one of the faculty here at the clinic. Thank you for allowing our nurse practitioner student to see you today. Would you mind giving us some feedback about the appointment?
Sure. So whenever we spoke about all the different treatments, the inhaler, the gum, I was kind of taken aback because I'm not even sure that I wanted to quit smoking. Also, when we spoke about my coach finding out, it kind of made me just want to shut down and not talk at all, because that's the last thing that I need is for my coach to find out and then get me kicked off of the team.
Yeah. Thank you for the honest feedback. Josh, in this case, I think we want to work a little bit more with Kevin, because quitting is not going to be so easy for him. So we want to understand a little bit more some of the pros and cons to his use, and work along with him on motivating so that he can be ready to try some of the nicotine cessation products like the chewing gum or the patch. It's good that you set up a 2-week follow-up. But it's going to be, a little hard for him to just quit cold turkey. We did understand the concern around the coach, and that's definitely a downside to smoking, but it's not going to be easy, and he's not exactly ready. So we want to work with him a little bit longer on identifying ways that would make it easy for him. So really, thank you for seeing us today, and we'll see you in 2 weeks.
In this scenario, the student's tone is authoritative rather than supportive, and he misses the initial opportunity to build rapport with the patient by ensuring confidentiality. The patient clearly conveys no willingness to quit smoking at the present time and appears to be in the pre-contemplative stage of change. Yet, the student disregards this and moves into treatment options. Rather than merely emphasizing a need for the patient to quit, the faculty member identifies an opening to provide the patient with more information and resources about smoking. The faculty member reminds the student that it is quite difficult to quit smoking and the patient is not ready. She encourages the student to meet the patient's current stage of change by encouraging a conversation about the pros and cons of smoking.
So, Mr. DeAngelo, we've listened to your lungs. There's some congestion there, and it might be related to your cough as well. And just looking at your chart here, when you came in, you filled out the Fagerstrom test for nicotine dependence, and I think that might be related. Would you mind us talking a little bit about nicotine use?
I mean, who's going to find out about this visit?
No one. This is completely confidential. It doesn't get back to anyone.
Okay, because
Are you concerned about that?
yeah, if my coach finds out that I've been smoking, he'll kick me off the team, and then no recruiter will see me play or anything. So
Sure. Well, no. Here is confidential.
Okay.
There's not going to be any information that's between me and you.
okay,
All right. So I think there is some connection between smoking and your lungs and the cough that you're having. If you would, like, what's a benefit of using right now that's continuing your smoking?
well, I only really smoke whenever I study. It kind of helps me calm down and helps me concentrate on what I'm focusing on.
Okay. So it seems like you're kind of using it as a tool to help you out with studying and keeping concentration.
Yeah, because I have to keep my grades up to play baseball.
Sure. Okay. What would you say was the downfall of your use?
I don't know.
Okay. If I may, I mean, already today you've spoken about the risks of your coach finding out you're smoking. Would you consider that a con, maybe?
Yeah, because then I wouldn't be able to play baseball anymore.
Yeah, and you're here for the cough, which your coach is concerned about. It must be affecting performance. I'm not there to see, but
Yeah, I mean, I definitely cough a lot more whenever I'm like sprinting, so it definitely affects the way that I play.
so there's some things happening. Okay. So just to discuss like a readiness to quit, on a scale of 1 to 10, 1 being absolutely not, 10 being I'm ready to quit today, how would you rate your readiness to quit smoking?
Like a 2.
2. So,
Yeah.
so you're not really there, kind of. Okay, I understand. So how much have you been smoking every day?
Like half a pack.
Half a pack. Okay, so that's about 10 cigarettes. All right. Would you consider maybe going down to 8 cigarettes a day or 7? Just to, now you're not quitting, you get some of the benefits, but you're also reducing some of the risks.
I mean, yeah, I'm willing to try it, but if it affects my grades, then I don't want to quit smoking.
Sure.
Just
Okay.
If my grades slip, then I won't be able to play. So that's not something that I'm willing to change.
And that's a valid concern, I understand. Okay, so if you're willing, I would be more than willing to see you regularly. We can continue to watch your respiratory, see if the cough continues, gets worse, gets better. Okay. And if you're willing as well, we can discuss your smoking and if you've been successful with going down, going up, or staying the same.
Sure. Yeah.
Okay. And if you're ready, we actually have a lot of other tools for you to use whenever you make that decision.
Okay.
All right. Well, thanks for meeting with me today, and
Thanks.
See you in 2 weeks.
Thank you.
Hi, Mr. DeAngelo. I'm Holly, one of the faculty at the School of Nursing. Thanks for allowing our nurse practitioner student to do your examination today. Would you be willing to give us a little feedback about how the appointment went?
Sure. All throughout the exam, I never felt judged, so I felt really comfortable and willing to talk. So I appreciated that. And when you said that my coach wasn't going to find out, I was more willing to open up and really think about a plan. And with the steps that you said, I'm really confident that it's not going to affect my baseball, and I will be able to play potentially even better. So I'm excited to see what happens.
Okay, thanks. Thanks for the honest feedback.
As you can see, the second example yielded a better outcome. Kevin was given the Fagerstrom test for nicotine dependence. This is a validated screen for patients with tobacco use. The steps to any screening process are to use a validated screen, introduce the subject, discuss the patient's score, and provide feedback. Kevin's score was a 5, indicating medium dependence. The student was able to use the screening tool as an entry point to discussing the pros and cons of smoking. The readiness ruler is a tool that can be used to assess readiness to change, as well as confidence and importance of changing from the patient's perspective. The tool allows the patient to direct the conversation and the clinician to identify strengths, enhance motivation, and assess level of confidence, as well as importance for change. In terms of next steps in this second example, the student simply focused on helping the patient move toward greater readiness to change, while introducing harm reduction techniques such as cutting back the number of cigarettes smoked. This is an effective SBIRT approach as well. For patients who are ready to discuss treatment, it is important to emphasize all treatment options and help the patient identify the one that might work best for him or her. More information about what SAMHSA recommends in terms of treatment options for smoking cessation can be found at samhsa.gov/ATOD/tobacco.